Hello, everyone. I wanted to talk with you about gender dysphoria, which is, of course, a section in the DSM-5. There's a diagnosis for individuals who feel like they do not belong in their own bodies and that they feel like their identity differs from that of their biological sex. So I'm going to start with talking about gender dysphoria in really clinical terms, straight from the DSM, and then I'm going to talk about best practices for working with transgender clients because that's actually one of my areas of research interest. So I will get into that next. So let me start by sharing gender dysphoria. And so basically with this one, I'm just going to be sharing the criteria. So for children, it's a marked incongruence between one's experienced and expressed gender and assigned gender. It should last for at least 6 months, and it's manifested by at least 6 of the following indicators: a strong desire to be of the other gender or an insistence that he or she is the other gender. In boys, a strong preference for cross-dressing or simulating female attire. In girls, a strong preference for wearing only typical masculine clothing and a strong resistance to the wearing of typical feminine clothing. A strong preference for cross-gender roles in make-believe or fantasy play, and a strong preference for the toys, games, or activities typical of the other gender. There's also a strong preference for playmates of the other gender. Let it also be known that, people who are not upset about their biological gender and feel perfectly comfortable and fine with it can also choose different types of toys. As we know, gender is a construction and it's socialized into us at kind of a young age. So just because a little girl wants to play with a boy toy does not mean that they are transgender, as I'm sure I don't need to tell all of you. But, someone who's a transgender child will find a strong dislike of their sexual anatomy, and they might desire for their primary or secondary sex characteristics to match their experienced gender. And so it's very similar for adolescents and adults. There's an incongruence between one's experienced or expressed gender and assigned gender. It lasts for at least 6 months, and it's manifested by 2 or more of the following indicators. So as you can see, for children, they have to meet 6 of the indicators. For adolescents and adults, they only need to meet 2. And it really is marked by an incongruence between one's expressed and experienced gender and primary or secondary sex characteristics. That's really it. If they feel like they are not in the right body or they're not the gender that they should be. And they will experience body dysphoria or a strong desire to be rid of one's primary or secondary sex characteristics because of a marked incongruence with one's experienced and expressed gender. Or in younger adolescents, there's a desire to prevent the development of the anticipated secondary sex characteristics. So they don't want to go through puberty and become a fully grown man or woman. They want to prevent the puberty and block that before it even happens. A strong desire for the primary or secondary sex characteristics of the other gender. A strong desire to be of the other gender or some alternative gender different from one's assigned gender. So there's not just a binary in terms of male and female, even when it comes to gender dysphoria. So some people are bigender, some people are gender creative, some people consider themselves gender queer. So they're not really one or the other or in between. They see themselves in a sort of androgynous way. And bigender means that one day they may feel one gender, the next day they may feel another. They may always feel like both genders. So there's a lot of variation in it, and it's on a continuum. There's a strong desire to be treated as the other gender or some alternative gender different from one's assigned gender. And there's a strong conviction that one has the typical feelings and reactions of the other gender or some alternative gender. And there's also other specified gender dysphoria or gender dysphoria unspecified. So for other specified gender dysphoria, These are the symptoms characteristic of gender dysphoria that causes clinically significant distress, but they do not meet the full criteria for gender dysphoria. Or the person meets the criteria, but for less than 6 months, and the clinician wants to specify the reason. In unspecified gender dysphoria, symptoms characteristic of gender dysphoria that cause clinically significant distress, but do not meet the full criteria for gender dysphoria, or the person meets the criteria, but for less than 6 months, and the clinician does not want to specify the reason. And it's for presentations in which there is insufficient information to make a more specific diagnosis. All right, so that is the DSM technical clinical criteria for gender dysphoria. And now I want to share with you the MSJCs. Okay, so now I'm going to talk with you a little more about the ins and outs of working with transgender or genderqueer clients that, aside from just the DSM. So these are counseling competencies for working with transgender clients. And so if you haven't already been exposed to it, the American Counseling Association has endorsed the multicultural and social justice competencies. So I'll talk about those a little more in a minute, but basically what that means is we are supposed to adhere to multicultural and social justice competencies in our profession. And, our ethics codes require us to be multiculturally competent. So today I'm going to talk a little bit about the transgender population. I'm going to introduce you to some terms. I'm going to show you the genderbread person, the mental health concerns of transgender populations, and then I'm going to share with you some multicultural competencies, some attitudes, knowledge, skills, and action. And there is a TED Talk in here, but I've left that in your module, so you can take a look at that when you have a moment. So these are the terms. You can just take a minute to look at those. Most people know what all of these mean, but a couple that you might not know is cisgender. So cisgender means that you are, just fine with your own biological gender and you don't have any gender dysphoria and you have no desire to be transgender. So if you're a female and you were born female and you feel fine as a female, you're cisgender. If you're male and you feel fine as a male, you're cisgender. And then I kind of mentioned before, but non-binary is not adhering to one or the other in a very specific way. It just means you fall out of the binary continuum. Drag queen is dressing up as a woman. It's more for entertainment purposes. Bigendered is feeling like there's two genders inside of you at all times. Two-spirit is a Native American term, and it's a celebratory term that celebrates gender ambiguity in their culture. Sex reassignment surgery, now it's actually called gender confirmation surgery, is the surgery affirming the transgender identity. So it's actually matching the physical sex traits with the gender identity with which one identifies. And drag king is when a female dresses as a male for entertainment purposes. Okay. If you have questions about those, of course, email me. I kind of pointed out a few that you might not know. Okay, take a look at the genderbread person. I love this because it kind of gives us a really nice way to understand gender identity. So as you can see on the brain, in the brain there on the genderbread person, that's where the person's gender identity lives. So they feel a woman, they feel like they're a man, or they feel somewhere in between, genderqueer. It's how you in your head feel about yourself, and it's the chemistry that composes you. So you're made up of hormones and thoughts and feelings and all sorts of things, and it's how you interpret what that means. So it's how you see yourself in the world. Your gender expression, as you can see on the outer edge of the genderbread person, is how you express yourself to the outside world. So you may dress feminine, you may dress masculine, you may be androgynous, you may be somewhere in between. And it's how you express, it's how you demonstrate your gender based on traditional gender roles through the ways you act, dress, behave, and interact. Your biological sex, and that's located in the groin area, and that means, it's what the genitalia that you were born with. So you could be female, you could be male, you could also be intersex. So intersex individuals are born with maybe hormones of the opposite male, or genitalia of both male and female, in the sense that they could have an internal reproductive system and an external male reproductive system. So yeah, this is made up of, the vagina, ovaries, XX chromosomes, penis, testes, XY chromosomes, and intersex is any kind of combination of the two. It could be hormonal, it could be physical. And that, that's a very different thing when you think about gender identity, because someone who's born with two sets of reproductive organs may feel a little bit differently and not, have it, but some may have very solid identity. So yeah, you want to talk to people and see what their gender identity is. And then your sexual orientation. So people get confused a lot about sexual orientation. Your sexual orientation is who you love, and that's why it's in the heart center. So, you can be heterosexual, bisexual, homosexual, and anything really in between. But that's who you're physically, spiritually, and emotionally attracted to based on their sex gender in relation to your own. And, people also identify as pansexual, which means they aren't attracted to a certain gender, they're attracted to the person. So this can be, on a lot of different levels. You can be physically attracted to certain people and spiritually attracted to others, or physically and spiritually attracted to both. So it's any combination thereof, but it's very different from your gender identity, because your gender identity is in your head and it's who you are. Your sexual orientation is how you love and who you're attracted to. Why is this an important thing to give attention to in the counseling world? Well, because non-binary individuals they're at much greater risk for mental health issues. They are, so of the 27,000 people who filled out their transgender survey, the US Transgender Survey, have attempted suicide. 40% of the population. This is almost 9 times the suicide attempt rate of the general US population. So it's huge. Psychological distress. So 39% of respondents reported extreme psychological distress in the month leading to the completion of the US Transgender Survey. There's greater economic hardship compared to the general population. 29% in poverty compared to a 12% rate in the US population, and higher levels of unemployment, 15%, compared with the US unemployment rate of 5%. And then homelessness is higher. 1/3 of the 27,000 respondents reported experiencing homelessness at some point in their lives. This is major. This is huge. This is why we really need to give attention to making sure that our transgender counseling clients are okay. So again, with this massive nationwide transgender survey, 54% of individuals experience some form of mistreatment, including being verbally harassed in schools, K-12 schools. 24% were physically attacked. 13% were sexually assaulted, all because they were transgender. 17% experienced such severe mistreatment that they left school as a result. The transgender individuals also experience mistreatment in their families. 10% reported family violence that occurred due to their transgender identity, and 8% were kicked out of their home for being transgender. So, mental health issues that affect transgender individuals: gender dysphoria, as I defined for you earlier, suicidal ideation, depression, anxiety, PTSD, societal oppression. These individuals are at risk for experiencing hate crimes, as the previous statistics just showed. Trans individuals struggle with related employment. Discrimination is important in institutions such as school, family, and work. Relationships and coming out might be something that you would work on in the counseling process, and other issues that have nothing to do with gender. So we want to be sure that we're not stereotyping when people walk through the door and they have a transgender identity. We don't immediately want to assume that they want to talk about their transgender identity or that they have gender dysphoria. It may be that they're there just to talk about, anything else. There are a variety, everything else that can afflict the human individual. So, all right, let's talk multicultural and social justice competencies. So, over the past 30 years in the counseling profession, counselors have worked really hard to be inclusive of a variety of individuals. It started with, racial and ethnic diversity, and it grew to include all sorts of things like religious affiliation, sexual orientation, gender identity, just the wide diversity of the human population. And we want to make sure that we are supportive of and affirming of all those different identities. So, the multicultural and social justice competencies that are endorsed by the American Counseling Association guide us, and they tell us that as counselors, we need to look at our own privilege and try to understand where we come from. We need to look at the client's privilege. We need to look at the client's marginalization, and we need to look at our own marginalization and know the ways in which maybe we've been oppressed that could impact the counseling relationship. We have attitudes, beliefs, knowledge, and skills and action within that. 4 things that we need to be aware of. And so that's how these are going to be applied. So this builds on the work of Sue Arredondo and McDavis, and it recognizes the power of privilege and oppression and its impact on clients in the counseling relationship. There are developmental domains: counselor self-awareness, client worldview, counseling relationship, and counseling and advocacy interventions. The culturally competent counselors strive to recognize and apply these domains to the counseling process, as well as the competencies within the developmental domains. So we've got these domains. We're looking at our self-awareness, like who we are as people. We want to understand the worldview of the client. We're looking at the counseling relationship, and advocacy, ways we can advocate on behalf of the client in society. Then we have competencies within those domains, such as attitudes and beliefs, knowledge, skills, and action. So how do we apply this to the transgender population? Where do my biases come? And should I reformulate my beliefs? Well, the first domain is about understanding yourself. So you need to understand your own values, your beliefs, and your biases, and try to understand how that could impact the counseling relationship. So you want to self-reflect. How does transgenderism, discrimination, and gender role expectations impact the counseling relationship? And how do these societal forces impact my client? I want to understand how gender roles impact my client. I want to understand how my view of gender impacts my client. And then we're looking at intersectionality. My client is not just a transgender client. My client is a person with a soul and interests and thoughts and relationships. And so I want to know what their religion is, their socioeconomic status, their race, their ethnicity, their sexual orientation, because you can't make an assumption that just because someone's transgender that they have a sexual orientation of gay or lesbian. So yeah, we really need to ask, because again, we look at that gingerbread person, their sexual orientation is very different from their gender identity. And we have to take a trans affirmative approach. So the American Counseling Association has officially endorsed a trans affirmative approach. That means that we are accepting, we advocate, and we have warmth for our transgender client. Attitudes and beliefs continued. So I need to understand my personal beliefs and how they might conflict with the client welfare. We need to seek supervision. A lot of us come from backgrounds with transphobia just inherent in the culture. So we really need to understand where we fall on that and how it might impact the client. And I already talked about withholding assumptions, so that's an attitude we need to have. And counselors support transition, whatever that means to the client. We avoid discouraging transition because research supports more positive health outcomes post-transition. The research has shown that suicide rates drop, or suicide attempts drop, suicidal thinking drops, people become more happy, their mental health improves when they're able to transition to the gender with which they identify. That goes up even higher for children who are supported in their transition, or young adults who are supported in their transition, if they're supported in their peer groups and in their families. So this is huge. We don't want to leave the client in limbo. So if they're not receiving appropriate medical care for transition, it can increase stigma. So for instance, if someone's trying to transition, but they don't have the appropriate hormone therapy, they may have a harder time passing, which will then put them at greater risk for harassment and actual, sexual, physical, and verbal assault in the community. So it's really unethical for us to keep a client from treatment, especially because they rely on us in order to get that treatment. So I'll move on to that in a minute, but we are the gatekeepers in terms of assessment and the ability to help them get hormone therapy and gender confirmation surgery, because doctors need letters from us to let them, to tell them that we think that is an appropriate treatment, and we share the liability with the doctors for that treatment. So what knowledge do we need to have when we're working with this population? Well, we need to be curious about the client's worldview and intersectionality of identities, diagnosis and assessment. We need to be able to assess for readiness for transition. How do we know if they really want to transition or not? We also need to know about hormone therapy in GCS, gender confirmation surgery. So we need to be able to diagnose well, because if someone's experiencing psychosis or dissociative identity disorder, that's going to be a lot different than gender dysphoria, and we certainly wouldn't want to endorse transition if someone is experiencing DID or psychosis or mania. So we need to be able to assess well. We need to use appropriate pronouns. We need to understand historical attitudes, societal biases, spiritual views, and stereotypes associated with transgender populations so that we know what our clients face. And we also need to try and help them know what they may be facing out there in the world if they start this transition. We're not discouraging it, but we need to prepare them for it. We need to know how to write letters of support for transition. You need 1 letter for hormone therapy, and 1 for chest or breast surgery, and 2 for gender confirmation surgery on the genitals. And the liability is shared with the medical doctor. And typically, hormone therapy can start pretty quickly. The surgery, you need to be in therapy for about a year. You need to prepare the client and support the client through hormone therapy and GCS. And counseling is not required for HT and GCS. Assessment is, though. So awareness of power differential is paramount. So if someone comes to us for hormone therapy and we say, okay, you need therapy for 6 months, we might be withholding them from treatment when we could have just written the letter if we did a thorough assessment and we knew that they were actually transgender. I would want to take a little more time with gender confirmation surgery just to rule everything out to make sure. But because that's a big deal. Surgery is a big deal, and we share the liability with the doctor as mentioned. We need to make sure we're appropriately treating for comorbid disorders. Just because someone has gender dysphoria doesn't mean that they don't struggle with depression or anxiety or bipolar disorder or anything else. We need to help people access community resources and supports. And we need to have knowledge of transphobia and discrimination in society and laws and policies in the area. We can set appropriate counseling goals based on holistic assessment. We can withhold assumptions, focus on strengths and resilience, and we can advocate by acting with and on behalf of clients. So, how can we act with and on behalf? Well, as we know, transgender individuals are discriminated against in major institutions. This could be schools, churches, workplaces, community centers. We can help. We can provide carry letters. So a carry letter is a letter that states that, I'm a transgender individual, I'm under treatment, I'm in therapy with so-and-so, because if they're pulled over by the police or they're hassled by a security guard for a bathroom situation, or they're getting harassed, and maybe someone's not sure what's going on, they can pull out that letter and that can help them kind of clarify who they are and what's going on, and can be a layer of protection. We can also, advocate with school counselors by helping clients get like an ally-friendly school schedule, a bathroom pass, locker room planning so that they have maybe a space to change that's safe. There are a variety of things that can be done in workplaces. You can talk to HR about how to come out, different things that we can do to help support our trans clients. We can also teach them how to advocate for themselves as well. So there are a lot of things we can do. We want to focus on strengths and resilience. That is pretty much all I have for you, but I talked a little bit about, all right, there are a few organizations I just want to throw out to you. So I talked a lot about the multicultural and social justice competencies, and I applied that to literature and competencies outlined by Algebatic. So Algebatic is where I got these competencies, or some of them. Algebatic is the Association for Lesbian, Gay, Bisexual, and Transgender Identifying Transgender Issues in Counseling. And they've come up with a list of best practices for working with transgender clients, which I've provided in your module. WPATH is the World Professional Association for Transgender Health, and they outline best practices for care in medical and mental health settings. And the American Psychiatric Association also has competencies. So what we need to remember is we need to have a trans affirmative approach to counseling. There are a variety of skills and attitudes and beliefs that we need to have when we're working with clients, and we want to make sure that we're following our multicultural competencies and analyzing ourselves, the worldview of our clients, and the counseling relationship. So that's all I have for you today. Thank you so much. Take a look at the TED Talk in UGLA, on UGLA, and that's in the module as well if you have a minute. And here are the references. Okay. Thank you so much for listening, and I hope you have a great day.